What is Alanine aminotransferase for liver health? Imagine your liver as a busy factory working tirelessly to keep your body running smoothly. To do its job well, it needs to stay healthy, and one way doctors check on its condition is by measuring an enzyme called ALT. ALT, or alanine aminotransferase, is an enzyme mostly found inside liver cells. It helps with processing amino acids, which are the building blocks of proteins. When liver cells are healthy, ALT stays inside the cells. But if the liver gets damaged or inflamed, ALT leaks out into the bloodstream, making its levels rise. That's why measuring ALT in your blood is a key way to see how your liver is doing. Doctors often include an ALT test as part of a liver panel or a comprehensive metabolic panel. These tests give a snapshot of your liver's health. If your ALT levels are higher than normal, it can point to different liver issues. For example, fatty liver disease, which is common especially in people with obesity or metabolic problems, can cause mild to moderate ALT increases. Viral hepatitis, caused by infections like hepatitis B or C, can lead to more significant ALT elevations. Other causes include reactions to certain medications or toxins that damage the liver. The level of ALT can also give clues about how severe the damage is. Very high ALT levels, over 1,000 units per liter, might suggest acute viral hepatitis, severe drug toxicity, or sudden liver injury due to lack of blood flow. ALT is usually looked at along with another enzyme called aspartate aminotransferase, or AST. The ratio of AST to ALT can help doctors figure out what kind of liver problem might be present. For instance, if the AST to ALT ratio is greater than 2, it often points to alcohol-related liver damage. If the ratio is less than 1, fatty liver disease is more likely. But ALT itself is more specific to the liver than AST, which is also found in muscles and other tissues. When ALT levels are elevated, it's important to do further tests to find out what's causing the problem. This might include additional blood tests to check for hepatitis viruses, bilirubin levels, or liver function markers like albumin and prothrombin time. Imaging tests such as ultrasound, CORT scans, or MRI can also help visualize the liver. Sometimes, a liver biopsy is needed to get a closer look at the tissue. Treatment depends on the cause. It could involve lifestyle changes like losing weight, avoiding alcohol, or managing underlying conditions. In some cases, antiviral medications or other therapies are necessary. Monitoring ALT over time helps doctors see if the liver is improving or worsening. In the context of liver health and the risk of liver cancer, keeping an eye on ALT is very important. Persistent liver injury and ongoing inflammation can lead to scarring called fibrosis, which can progress to cirrhosis. Cirrhosis greatly increases the risk of developing liver cancer. Regular testing of ALT and other liver markers allows healthcare providers to catch problems early, start appropriate treatment, and prevent serious complications. In summary, ALT is a vital marker used to detect liver cell injury. It helps guide diagnosis, monitor disease progression, and evaluate treatment effectiveness. While an elevated ALT doesn't always mean there is a serious problem, it signals that further investigation is needed. Always consult with a healthcare professional for personalized advice and proper management of liver health. Remember, understanding your liver's signals is a key step in maintaining overall health and preventing more serious conditions down the line.